Do you constantly feel that dull, throbbing pain in your head? And no matter what you do, it just wouldn't go away. Headache can feel like a mystery, one that can steal your focus, your joy, your energy. If I told you that the answer could be simpler than you think, stick around because in today's video, I am going to be discussing the causes of this headache, how to avoid and how to manage this headache so you don't tend to keep having constant headache, and when to see a doctor. The first thing you need to know is that there are different types of headache. Okay, so the first one I would like to talk about is the commonest one, which is tension headache. When you talk about tension headache, it's one of the commonest and the mildest form of headache. It comes with stress. So when an individual is stressed or when an individual is constantly in a bad position, this is the kind of headache the person would always experience, and that is called the tension headache. The next type of headache I would like to talk about would be the migraine. A lot of persons complain about migraine. Usually it is one-sided and it comes with other symptoms like photophobia. The person will be scared of going outside the sun. Phonophobia, this person is scared of sound. And it can also come with nausea and vomiting and other things. So once the patient is giving us this history, we'll know that, it can be migraine. It can be migraine and not tension headache. And another form of headache is cluster headache. This occurs in cycles. The patient will tell you that this is one of the worst headache I've had in my life. Like, it's very, very severe. So I think I'm even calling it in order of severity. So when you talk about cluster headache, it is very, very severe form of headache. So what are the causes of headache? The first thing on my list is stress. Stress can cause headache, and if you can learn how to manage your stress level, frequency will start reducing because you are now working on what is causing the headache. So whenever somebody is talking about tension headache, the first thing that will come to your mind is, how is this person daily activity like? Does this person rest at all? And there can be so many things that can stress somebody, apart from the physical activity itself. You can also want to explore other aspects of the person's history to know what is causing this headache exactly. Then the next thing that can cause headache is dehydration. So some of us wait till we are thirsty before we take water, and when you are too dehydrated, it can cause headache. Okay, the next thing that can cause headache is sleep problem. Are you having enough sleep? How many hours do you sleep in a day? Do you sleep up to 7 hours in a day? Okay, let's say 6 hours in a day. Or you sleep like just 2 hours, 3 hours in a day. If you constantly deprive yourself of sleep, you would discover that you will constantly be having headache. So try and sleep well. And the next thing that can cause headache can be poor posture. When you talk about poor posture, I'm talking about office workers that tend to strain their neck so much when they are walking. They don't even have a time to stretch their body, and also by the time they are done with whatever they are doing, they will discover that they're having headache already. Poor posture can cause headache. The next thing that can cause headache that I would like to emphasize are some underlying disease condition, and the first one I would like to talk about is hypertension. So if your headache is not going, like you have tried everything and the headache is still there, you might want to check your blood pressure. Like, I think sometime last 2 months, I got a call from somebody I know. He told me that he has been having this headache for some time now, and he has taken paracetamol, some painkillers, and the headache is not going away. So I was like, have you checked your blood pressure? Please go to the nearest pharmacy shop and check your blood pressure. He went there, and when he checked his blood pressure, he noticed that it was 170 over 120. I shouted, okay, wow, this is the value you got. Okay, rest for some time and do it again. He rested for some time, did it again, it was the same thing. So I had to prescribe some drugs for him, and then I told him to commence that drug immediately. Okay, he took the drug and the headache stopped, and he wanted to stop the drug. I told him, no, it's time to meet a cardiologist so that you can be sent for some investigations and then maintained on a drug because you are hypertensive. You see that hypertension can cause severe headache. It can give you constant headache, especially when it comes with eye symptoms. Please don't overlook that. Another thing that can cause headache can be your diet, what you are eating. There are sometimes when I take a particular food, I will discover that I will start having headache throughout that day, and I will just have to take note of that food and I will try not to take it again. So I'll be listing some food that can cause headache, and the first one on my list is caffeine. Food that contains caffeine can cause headache. Some persons can use it to calm themselves down and they'll be happy, but to some persons it can cause headache. So if you notice that whenever you take caffeine containing products and you're having headache, you might want to reduce that. Okay, the next thing that can cause headache is alcohol. I have someone then when I was growing up that after taking alcohol he would start complaining of constant headache. I was like, why not stop taking alcohol? Something is not good for your body and you are still taking it. Why not stop taking that? So some persons after taking alcohol would complain of headache. So alcohol can cause headache if you take alcohol, especially when you take it in large quantity. That can cause headache. I apologize to chocolate lovers, but yes, chocolate can cause headache. When you take chocolate, especially when you take it in large quantity, you will discover that you're having headache. It can cause headache too. Enough of the causes of headache. Let's talk about how to prevent headache. Okay, stress can cause headache, so of course you should try to avoid stress. Take enough water every day as much as you can. Okay, don't wait till you are thirsty before you take water. So most times you can just be intentional about taking enough water. Okay, try to sleep well. Okay, try to reduce screen time so that you can sleep well. Pressing your phone throughout the night, in the morning you wake up and you will be having headache. So try to reduce your screen time at night and sleep well so that you reduce the frequency and the intensity of headache. Okay, then if you're having headache, you can start up with some painkillers like paracetamol. Here it's easily available over the counter, but then don't abuse it. If you've taken it and the headache is not stopping, please, it's time to meet a doctor, or you need to check your blood pressure and explore other causes of headache. Okay, self-medication, in as much as it can help relieve symptoms while you wait for doctor's appointment, is not so nice. It's your doctor for proper examination, investigation, and then proper management. The warning signs that you should not neglect. The first is when somebody close to you complains of a thunderclap headache, sudden severe headache. You're just talking with the person and suddenly the person will shout, "Oh my head, I felt like kind of a very severe headache," and suddenly the person will go into unconsciousness. You have to be fast. There's something we call subarachnoid hemorrhage in medicine. That can be the cause of that severe headache. So immediately, the first thing you should do is to rush the person to the hospital. Don't waste time. Don't go trying to buy medication or take the person to the herbalist. That situation can be subarachnoid hemorrhage, and most times it can be a very deadly condition. Okay, the next form of headache that you should not ignore is when you are having headache after head injury. You had a fall with your head and you sustained minor injury in your head, and then you are constantly having headache afterward. Please see a doctor. Don't stay at home and manage the symptom silently. The next time to see a doctor is when you are having persistent headache with visual symptoms. Okay, maybe you notice that you cannot see very well and you're also having headache constantly. You might want to see your doctor because maybe you are hypertensive, or maybe it can be a sign of tumor. You might also want to see a doctor for that. If you're short-sighted, or maybe you are using glasses and you're having constant headache, you might want to see your doctor for change of glass or for further examination. Okay.